Hello and welcome to today's webinar, Building an Indigenous Mental Health System of Care, the Thunderbird Partnership Foundation, Hope, Meaning, and Purpose. We're pleased to provide simultaneous translation for all on-call webinars. This may result in a few quick pauses in the dialogue today. I'm Joanne Daniels, Improvement Lead, Northern and Indigenous Health with CFHI. Rosa May was unfortunately unable to join us today, so I am pleased to be acting as host for today's webinar. I'm joined in our CFHI studio by our producers for today's webinar, Kelly Ripley and Sheena Powell. We welcome all of you on the line today. As I introduce our guest speaker, please take a moment to introduce yourselves in the chat box. Who you are, what organization you're from, and if you're in a boardroom with multiple people, please introduce everyone. And I see that a lot of people have already done that, so thank you. Our presenter today is Carol Hopkins, Thunderbird Partnership Foundation's Executive Director. Carol is Know-Them, Mother Wolf, of the Wolf Clan in Delaware, First Nations of Moravian Town, Ontario. Carol, I'm sorry that my pronunciation was probably terrible. Carol is the Executive Director of Thunderbird Partnership Foundation, and Carol's work in the field of addictions has included many things, including serving as the chairperson for the National Youth Solvent Addiction Committee from 2000 to 2007. Her strength in the health profession is the ability to blend Western and Native traditional health and healing practices in a competent and responsive manner. This webinar is part of CFHI's Recommended Learning Journey of Indigenous Health and features the Thunderbird Partnership Foundation. The foundation was formed in 2015, combining the strengths and experience of the Native Mental Health Association of Canada and the National Native Addictions Partnership Foundation. A recent study found that 1/3 of First Nations clients who entered treatment for addiction were diagnosed or suspected of having a mental health disorder. Thunderbird Partnership Foundation plays a crucial role as the cultural and professional voice advocating for a systems approach, one that empowers hope, belonging, meaning, and a purpose for First Nations and Inuit. In addition to the objectives listed here, we will hear examples of hope, belonging, meaning, and purpose in action. Throughout this webinar, you're invited to type questions and comments in either official language into the chat box on the right-hand side of your screen. Where possible, we will do our best to answer them as we go along. We have also reserved an interactive question and answer period for you to ask any questions you have of our guest speaker. Any questions we don't answer today, we will address via email after the webinar, and of course, you can always follow up with us offline. I'd now like to hand over to Carol. Please proceed.
So good afternoon, folks. Nojem Indigenous, Gaye Maingan and Dorem, Lanilanape Koyandao. I'm from the Delaware Nation at Moravian Town. Moravian Town named after the Moravian missionaries that settled there with us. Some years ago, we originated on the eastern seaboard of North America and then migrated inland. Both of my parents are from Delaware Nations in southwestern Ontario. There's only 2 Delaware communities in all of Canada, and they're both located along the Thames River just outside of London. I'm thankful for the invitation to participate once again in this discussion around Indigenous mental health, and just to say also that as the National Native Addictions Partnership Foundation, we were established in 2000, and then in 2015 with our partnership and integration with Native Mental Health Association became the Thunderbird Partnership Foundation. In this presentation today, I'd like to give you a little bit of a background about who we are and the kind of work that we are involved in, and then the rest of the presentation is quite lengthy, and it's meant to provide a vast or an array of examples, I should say, about key concepts that are at the very center of the mandate that we have in the work we do related to addressing substance use issues and mental health. And those are hope, belonging, meaning, and purpose. Some of them are our specific work, but others are stories that I was able to find through a search in the news and other initiatives that we're aware of as an organization. And I just want to acknowledge as well that I see that there are folks from Ontario, but also from across the country, east and west, and in a wide variety of settings, government, academics, community-based services. So I'm hoping that you can find some value in the presentation that might relate specifically to the work that you're involved in. I think there was a little bit of an introduction to who we are and our mandate as an organization. Let me say first of all that we are a national organization supporting First Nations and Inuit. However, most of our work is focused with First Nations population, and it's focused on using culture as a foundation for addressing substance use and mental health, but under this concept of wellness. And key to our mandate in informing the way that we approach our work is this mental wellness continuum framework. And I talked a little bit about this on a previous webinar. I'm not sure if some of you are joining after hearing that first presentation. So I'm not going to go into this in any depth. There's lots of slides to get through. But to say that at the very center of this framework, it's very comprehensive and complex. It has the outcomes of hope, belonging, meaning, and purpose. And so what that says to us is that for any of us who are involved in facilitating, promoting wellness amongst Indigenous populations in Canada, that we should be having conversations about to what extent does it achieve or have some balance across hope, belonging, meaning, and purpose in the population that's being served. And the framework is, it has a population health approach. It looks at social determinants of health, and the background of it is culture, because it says that culture should be the foundation for the way that we approach our facilitation of wellness. And then there are some key themes in addition to culture as the foundation: community development and ownership, quality health systems, and competent service delivery. And I hope that you'll see some examples of that in the presentation today. The importance about collaborating with partners across government and also across my computer is saying connection is lost, but I am still on the phone, and I'm going to continue presenting, and I'm going to hand over, oh, it's back again. I was going to say I was going to hand off the slides to either Joanna or Sheena, so if that happens again, that's what we'll do. The framework also looks at enhanced flexible funding investment. So where there's funding coming in from a variety of partners, that First Nations governments and service providers, organizations should have the flexibility in terms of how it blends that funding to meet its priorities. And some of the supporting elements: performance measurement and research, of course, talking about workforce development. And if you think about culture as the foundation, then who is the workforce? Who has the knowledge and skills and Indigenous knowledge that needs to be part of the conversation? How do we facilitate change so that we are having the conversations about the role that culture plays, how we work across partnerships, across jurisdictions, and then what does governance mean, the inclusion of First Nations governance, and the rights to self-determination. So it's this model that is informing our current mandate. We are also part of developing the Honoring Our Strengths, a renewed framework to address substance use amongst First Nations people in Canada. The development of this framework, which we launched in 2011, has more of a focus on substance use issues, and I can appreciate that the model is somewhat difficult to see on the slide in front of you, but I encourage you to go to our website and get the full document. Both of these models talk about culture, and you'll see culture again at the very center, and that they both also have a strengths-based perspective. We don't have broad funding for the implementation of either one of these frameworks, and so partnerships are critically important, but also being really clear about where we're focusing our energies and building opportunities for collaboration. And so some of our priorities for this current time that we're in is all about partnerships, strengthening and developing new partnerships to assist in the development and the implementation of both of these frameworks. Using evidence-based cultural approaches and relying on Indigenous knowledge as part of that evidence, certainly around communications, and leveraging data to increase cultural resources. And so that's about a national information management system that we are supporting as an organization related to addictions and mental health services. And then where there are regional strategies, provincial strategies, territorial strategies going on that we can support by using these frameworks, then we're also participating, and there's a couple of examples in the slides. We're trying to, again, reach as many folks as we can through social media. So this is just an example from our annual report last year. We do a lot of training, and we have developed a number of guidebooks. We have online training available, but we also do face-to-face training, and on the slide you can see an example of the strengths-based training model that we use, and then there's a list of other trainings that we have available. And one of an example of a relationship and a partnership we had with the Manitoba government, provincial government, was to develop this early intervention program, and so we've delivered it in many First Nations communities in Manitoba, and then have been delivering it across the country. Right now we have a number of projects in BC. And this is a 26 module curriculum that was designed for grades 7 and 8, but it's been delivered to grades 9 and 10 as well. In Manitoba, they translated it into Lakota language. It's a good program. It's a week-long training for this program. The Addictions Management Information System is what I mentioned earlier. So treatment providers, First Nations or treatment providers in the National Native Alcohol and Drug Abuse Program have access to this system, so that we have one national database around addictions and mental health for First Nations, and a new tool in that system is the Native Wellness Assessment, and by next week that will have communities who are interested as well will have access to the Native Wellness Assessment through our website, and again it'll go into the same database. That was developed from Cultures Intervention Research. It was a CFHI funded research, 3-year research project, and so that assessment was the primary objective of that research project. It's a psychometrically sound tool, but we have a number of other knowledge exchange tools that we developed as a result of that research, some videos, the Indigenous Wellness Framework, a number of publications, workbooks around facilitating wellness, and you can find them on the website, our website, or the link on the slide here is to the website that is connected to Dr. Colleen Dell, who is our partner in the research at the University of Saskatchewan. We're also part of the Canadian Depression Research and Intervention Network, First Peoples, First Persons Indigenous Hub, and in that network we are having conversations about priorities for the inclusion of Indigenous intelligence, Indigenous knowledge in research related to depression and trauma anxiety, suicide, those kinds of things. And there's a resource that I've highlighted here that could also be further information for understanding depression in Aboriginal communities and families. I encourage you to look that up. And then a lot of our work, like I said, is about promoting culture as the foundation. And so we think about some common theories that we use in addictions and mental health, and our interest is in not replacing that. We've spent a lot of time as First Nations people adapting Western-based theories and to fit our population, our service settings, and infusing them with Indigenous culture. But we're also interested in bringing forward Indigenous knowledge and healing practices, and that's what both of those frameworks talked about earlier, is that while we have invested in adapting Western-based theory and practice, we also have to invest and make space for the decolonization of Indigenous knowledge and include traditional healing practices in the way that we address addictions and mental health. So an example is from a partnership is actually from the Ontario government. And so on the slide, what you see here is the annual report, and the Ministry of Health and Long-Term Care established a leadership council to look at phase 2 of the implementation of the mental health and addiction strategy. And in this process, they've established an Aboriginal engagement strategy where First Nations people, urban, Métis populations are having a conversation about what do they need, what's working for them, and how can they give advice to the Ministry of Health and Long-Term Care in specific areas related to the needs of First Nations people. And so this report is available online. It's the annual report from the first year of the Leadership Council. And some of the advice that we've given to the government so far is about transforming or altering funding mechanisms so that there's direct funding to First Nations governments and service providers, and that allows more governance related to culturally relevant models of services and flexibility for using the mental wellness continuum framework for the design and delivery of services and programs. Looking also to approve nurse practitioners as prescribing authorities for buprenorphine and naloxone. Naloxone is now you don't need a prescription for it, it's available. And then also talking about the infrastructure that we need for data systems so that we can pay better attention and have better evidence and more information for program planning and decision making. A few examples in terms of participation in national committees and collaboration. One is with the Mental Health Commission of Canada. You'll see in their guidelines for recovery-oriented practice that there's reference to the Indigenous Wellness Framework that was developed through that CFHI-funded research project, and I see some participants from the Mental Health Commission on the line today, so happy about that. We also participated in the development of the first Do No Harm responding to Canada's prescription drug crisis, along with the Assembly of First Nations, wrote the content in that document specific to First Nations. Also have a partnership with the Canadian Centre on Substance Abuse, and you can see on that document, happy to have our logo on the front so that it says to people that the competencies specific to substance use workforce was a partnership between CCSA and Thunderbird Partnership Foundation. And we also participated in the committee that was hosted through the CCSA on developing the systems approach to substance use in Canada, the National Treatment Strategy. So that's just a quick overview of some of the activities that we're involved in. But I want to talk to you more about hope, belonging, meaning, and purpose as outcomes and what that might look like. So the World Health Organization is talking about in this quote that health on its own limits our vision, right? And so we have to think about how health exists within broader social conditions, social determinants of health, and probably speaking to the converted on the webinar today. But for First Nations people, this is critically important, that the way we structure policy, the way we design programs and services can't ignore the environment and the historical environment and the transmission of trauma across generations of people and how that shows up in our health today, whether it's health of an individual, family, or of the whole community. And that we have to be critically aware of the inequities, the lack of access to health care, and the poverty that exists in First Nations communities as well. So if we don't pay attention to those, then we just continue to spin our wheels and not get very far. So this is, on this slide, the Indigenous Wellness Framework. Oops, went too fast there. In the framework, you'll see hope, belonging, meaning, and purpose on the outside. And the way we talk about this is it's a medicine wheel. And when we're using the medicine wheel as a model and a teaching tool or a framework for articulating and conveying our worldview, we always start in the East because that's where life begins. And so hope, belonging, meaning, and purpose, whereas a lot of times people tend to start at the top, and so they'll talk about purpose. But there's the way we approach the discussion is, again, in line with worldview. In the framework are 13 indicators for hope, belonging, meaning, and purpose. And for hope, it's investing in knowing. Belief is worldview. Connection to identity, and what is identity, but also an awareness of Indigenous specific values and how they play a role in addressing substance use and mental health, promoting wellness. And so as an example here of belief, I've relied on some evidence that's specific to language and how language plays a key role in this one research project. In this journal article here, it's talking about Indigenous language playing a role in lowering diabetes prevalence. And so it should cause us to think and to wonder, what does language have to do with diabetes? What does language have to do with chronic health issues? And so I would encourage you, I'm not going to give you the answer, I'm going to encourage you to look up that journal article and to explore that and have more conversation about it. But it's, in here it's talking about the link to cultural continuity and also as a protective factor related to suicide. Now, I know some of you might be thinking about Attawapiskat and other communities in Canada who have recently declared crisis related to suicide, and they do have their language. But you have to also think about, is language a commodity for conversation, or is language anchored and tethered and linked to worldview, and how does the programs and services, and critically the education programs, when they are available, link people to worldview that's held in language and the belief that comes from that. Another example, this comes from, excuse me, this is a program, Living My Culture, is related to palliative care and conversations related to grief and preparation for helping families with serious illness. And so it's a resource that articulates belief. And in this quote, it's talking from an elder from Six Nations of the Grand River, which is located in southwestern Ontario, that we take care of our own people. We need to be able to see what they need. If they need a medicine, if they need a song, then that's the responsibility that we have as Indigenous people, to walk as far as the grave with them. And then from the other side, that's where they take over. And so they're talking about a connection to lineage and ancestry into the spirit realm. And it's not saying this specifically, but what it's referencing is a worldview and a belief that the spirit lives forever. And so it's critically important to consider that the spirit journey across the developmental stages of life, including at death. Identity plays a key role in addressing substance use, this is about a program specifically to address suicide. And they're finding in this project specifically, so Nunavut is northern Quebec, that they've had good results. And then, as I referenced earlier, that Attawapiskat, you probably have seen the news about that as it's gone across the world, the story about the complicated grief that exists in this community, and their declaration of a state of emergency after a number of suicide attempts. And they're talking about the impoverished environment, which seems to promote this sense of hopelessness, and young people in the community talking about who cares, who are the people and where does caring come from. And from their own internal perspective, they understand the complicated grief that they have as a community, and then how do they address that, and how do we promote hope in communities such as this? So you've seen probably the news where there's teams, including cultural practitioners, who have gone into the community to offer support. And I think one of the important points about this is that the community has a strong foundation, and so First Nations communities have incredible resilience, and whenever we see crises in the community, we can't assume that they don't have answers, that there are other things that are interfering with their capacity and their ability to use their knowledge and apply it in ways that are meaningful to address issues such as the suicide crisis. Values, another key indicator for promoting hope. And in this example, again, it's talking about how children found their voice by the use of Indigenous languages in schools, and where children saw themselves in the education environment, they were able to achieve better results, stay connected to education. And that language is the fundamental vehicle for the conveyance of values, of histories, of our own story as Indigenous people and our culture. And despite the effects of colonization, oppression, that we still maintain a constellation of values that have been resistant and have been perpetuated across generations. And so, again, it's a reminder that culture as the foundation is the foundation of strength. And so despite challenges that we have in communities, there's still a presence of our values, and using them in practice is critically important. And so one of the essential values is expressed in Ojibwe as Pemarazewin, which is talking about life in the fullest. And there's different ways that that's facilitated. And so in this example from Manitoulin Island, a program, it developed a program focused on that very concept, and so they used their language to articulate and to structure their program. So, for example, the way they saw cultural practitioners are helpers of the Creator. That's quite a different concept when we're thinking about the helping relationship. And changing the idea of clients to our relatives certainly helps to destigmatize and to address discrimination when we're helping people, so for example, with opiate addiction. And then relying on our own medicines, and the translation of the word for medicine is talking about strength from the earth. Again, another example about worldview and values. And so these things all promote hope, and in the Native Wellness Assessment, it's a tool that measures these things. And then moving on to the next outcome of belonging, the indicators are relationship, family, community, and attitude. And I'm not going to speak to all of these, but I will highlight some of them. And this one is coming out of the story called Deep Water, which is a story that talks about young people who don't have access to education at the secondary school level in their own communities, and then have to leave their community. And so this is the story of Thunder Bay, where there were a number of young people who had gone missing and were found in the river. And so the story Deep Water explores the experience of First Nations communities who have to send their young people out in order to go to school. And there's some reflection in this one story about returning to the land because that's where home is, and the history that's there, and going to school with no parents, no guidance, is a completely different environment. And so one of the First Nation schools there has now a program where they remember the kids who died, and it's about prevention and advising kids about how to be in the city. Quite a different experience for First Nations kids wanting to get education. The importance of family. So I'm sure in the media you would have seen stories and questions about why don't they just leave their communities? Why don't First Nations people just leave those isolated communities then for a better life? And so in this response to that question is, that's where our family is. And so if we leave, the old people are not going to go. Who's going to take care of them? And beyond that, what about our ancestors who are buried in the land there? So these are critical values related to family and the importance of relationship and family. Again, is expressed through, and this is some examples of mental wellness teams that exist in Canada are having really good outcomes. Their approaches from this concept of two-eyed seeing, blending Western-based practices with Indigenous cultural practitioners and practices to cover vast geographic areas and provide services to First Nations communities who might not otherwise have them. But also looking at child welfare. And in Canada, there's been the adoption of the family decision-making model that was developed in New Zealand, and the impact that that's having with keeping families together. And we know that a large majority of kids in care are there because of poverty. And we have more kids in care today than we ever had in residential schools. And so in community, another critical indicator, and this example is an example of Idle No More from North Caribou Lake First Nation, and also an initiative that was called Summer of Hope that was focused on building literacy and connecting kids to culture. Good examples of communities and community strength. Also, First Nations communities in Northern Ontario are using culture along with buprenorphine to address opiate addictions and having great success and finding community outcomes as indicators of success that are critically important. And then attitude. Attitude is sometimes confusing for folks as when we think about that as an outcome, but attitude is critically important given what we've talked about in terms of social determinants of health, but attitude is about an attitude towards living life. Attitude is about knowing that there are answers in life, and it comes again from belief and value, worldview. And attitude is knowing again that there are critical spiritual requirements at every developmental stage of life, and that actually begins before we birth our children. And so while the fetus is still in the womb, we have responsibility to begin taking care of the spirit at that time, and then certainly when they're born, to tether them and to tether their spirit to the earth, as well as the way that we dress them up. So in our programs and services, we can use this concept about tethering people to life and getting them connected to life for informing. How do we do that in our programs and services? How do we connect? How do we engage First Nations people from a cultural perspective in our programs and services? And then how do we dress them up with culture to help them achieve wellness? This is an example from treatment, and it's an example about Western ways of thinking along with cultural practices. And so this is, we send young people to residential treatment, and then they go back home to environments that maybe not have changed, and we wonder what hope do they have, and what type of outcomes can we realistically expect if nothing else has changed. And so this is a story about a young girl who does go home from residential treatment into a community where culture and cultural spirituality isn't readily practiced, but has a significant influence in the family around her. So I'll leave that to explore on your own. And then meaning, which is the rational, the things that we learn through life, as well as our intuitive, our spiritual knowledge, and then how we blend them together to create understanding and to create meaning for life. And this is universal, right? When you think about people, everybody wants to know what's the meaning of my own life. And so going back to the Summer of Hope example, again, where 5 northern communities, again, invested in literacy summer camps initiated by Ontario's Lieutenant Governor James Bartleman. And what those camps did for kids in getting them connected again and re-engaged with reading, but also their education, and again, towards that attitude of living life and enjoying life, despite whatever might be the social determinants of health around them, gave them opportunity. And then understanding. I want to mention Chief Spence, who was chief at Attawapiskat in 2012, who did a hunger strike and with prayer to raise attention to the social determinants of health and specifically the housing issues in Attawapiskat, which led to the national dialogue between First Nations and federal government. So there was an outcome. But what she did was she took an understanding about the meaning of life and she applied it to make some difference for First Nations people, not just her own community, but nationally. And then we also have to think about special populations, the needs of different populations like two-spirited people. And so there's a suicide prevention guide, and although the National Aboriginal Health Organization doesn't exist anymore, the resources are still available on the website. The First Nations Health Authority out of BC put out this great document. It's a path forward, and in the document it also includes a spectrum of substance use, and it articulates how cultural use of certain substances is not problematic, but it gives some understanding to a cultural perspective. So it's a really good resource. It's got its own model of wellness, and developed by the First Nations Health Authority, which also informed the First Nations Mental Wellness Continuum Framework model. And then that intuitive knowing that comes from culture. I would encourage you to look at our resources on common cultural interventions. And what's central to these interventions is Indigenous language. And so this is not a pan-Indian approach. This comes from conversation across the country where we asked people, how do you use culture to promote wellness? And these were the common interventions that people talked about across cultures, and how they're applied certainly is specific to the land and the people and their language. And then purpose, way of being, way of doing, and wholeness, the last three indicators that contribute to purpose. And so way of being, again, this goes back to the story of Deep Water, where this young woman was reflecting about her experience coming out of an isolated community to Thunder Bay to go to school. And she says that she remembers not eating for a long, long time, because for days she would go without food because the store-bought food was foreign to her. And the cupboards and the food was locked up in the environment where she lived. She was used to eating berries, moose meat, bannock, duck, and fish, which wasn't available to her. And so, again, something for us to think about in terms of wellness, especially for students who don't have education. And then way of doing is about living life on purpose and with purpose. And so a champion of that for sure, and a role model is definitely related to the story of Cindy Blackstock and her fight for children and in the Human Rights Tribunal related to child welfare. And she, so she's been identified as a single mom with no kids except for the 163,000 that she has the honor of working with on equity issues. And so we have to give special attention to how do we create equity for First Nations. And so way of doing is something that I think engages all of us as having responsibility to create equity related to wellness for First Nations people. And then wholeness is we have to think of everything together. It's the comprehensive, holistic perspective that when we invest in hope, belonging, meaning, and purpose, it influences other aspects of this Indigenous wellness framework. And so I'm going to end there and open it up for questions or comments. And again, say thank you for your participation today.
Thank you so much, Carol. At this time, we would really love to hear from our participants. Please submit your questions or comments in either official language in the chat box at the bottom right side. I see that there's a couple of people typing. I'd like to start off by asking Carol, what do you see as the next crucial steps to sort of promote what is the strengths that are working in some of the Indigenous communities or surrounding suicide prevention? What are the barriers and facilitators for spreading those successful programs, do you think?
Well, one of the I think one of the key things that we have to keep in mind, and probably everybody knows this on the phone, but I'm going to say it anyways, is that there's no silver bullet, and that we absolutely have to collaborate and we have to partner. But beyond collaboration and partnership is integration. And so oftentimes for funding to First Nations communities, there's the requirement of evidence-based practices, and we don't have good evidence around prevention strategies and programs, and we're just now investing in gathering evidence related to the impact of culture and the importance of culture. And so I think we have to make sure that we're developing conversations with First Nations people and appreciating the leadership of First Nations people and believing that First Nations people have answers that lie within their culture and their cultural practices, and that if we invest, that it's possible that we will develop the evidence, and that when we're developing publications and writing about those good stories, that it's important that First Nations voice has space to articulate how culture plays a role. And so I see one of the questions here, and I think it relates to the question about how do we invest and what do we do in relation to suicide. The Native Wellness Assessment is a strengths-based assessment, and even in communities where there are the struggles and there are the challenges, I think it's critically important that we assess wellness, because I think that helps us to tell the story about the culture that still persists, and how then we might be able to use the culture to invest towards the solutions, towards what's going to make a difference. And so the wellness assessment is based on the Indigenous Wellness Framework. It's structured with those 13 indicators, and it's based on Indigenous knowledge. So again, most assessments measure the absence of illness or the reduction of challenges. And if we use the wellness assessment in community, it's across a whole community or a population, say for example a school, or with a specific program, it gives us a good measure of wellness and where we can invest in wellness in First Nations communities.
Thanks, Carol. We have another question from Carrie, wondering if you have any examples from Eskasoni Mental Health Department in Nova Scotia.
I don't, but maybe Carrie does, that she would like to share with us.
That would be great. If Carrie wants to share any of those stories, she could send them to us here at the Foundation.
What I will say, though, is that in Atlantic Canada, there have been really good conversations about wellness and about the mental wellness continuum framework and how it can inform First Nations communities in Atlantic Canada. It's well developed, it's well articulated, it's based on community conversation.
Thanks. Carrie, if you want to share some stories with us, you can send them to our attention here at the Foundation, and we will be pleased to share them with all participants. We're actually going to be forwarding copies of both Carol's slide presentation, as well as including links to the amazing reference documents that Carol has included in her slide presentation. So we'll be able to, you'll be able to have links to all of those documents going forward.
And I see another question about accessing the wellness assessment, and I have to apologize. I thought I put our website address in the presentation, but maybe it's not there. So the wellness assessment and the Indigenous Wellness Framework and a number of other culturally based toolkits and guidebooks are available on our website. And I'm going to just type it in here so that people can see that. There we go. So that's our website.
Great, thank you. And thank you, Carol, and to everybody for their questions and comments. So coming soon, we have a couple of other webinars. Additional webinars in the CFHI's recommended learning journey on Indigenous health are being planned for later this year, so please continue to check CFHI's website for more information on those. There are also 2 upcoming webinars in CFHI's regular on-call series, Integrated Pathways for Mental Health and Addictions Assessment and Transforming Regions into High-Performing Health Systems, which you will be able to find information on them shortly on our website. That's cfhi-fcass.ca. In addition, the 3 previous webinars in this particular series are available on demand. They were held in December, March, and April of this year, including the second in the series that Carol has been wonderful enough to do for us, which is a little bit more information on why culture matters within Indigenous mental health systems of care. So you can access them at those links or by going to the Foundation's website and looking at on demand. Your feedback is very important to us, and we ask that you take a minute to complete the following survey. And in addition, we invite you to sign up for our CFHI newsletter and keep an eye out for full listings of other upcoming webinars. I'd like to thank Carol again for her excellent presentations, and Sheena and Kelly working behind the scenes to make this webinar happen. And of course, thank you so much to you, our audience, for joining us today.
Thank you. And thanks everyone for your participation.
Thank you. We'll leave the survey up for a few more minutes so that everybody gets a chance to answer. We really appreciate your questions and comments, and we will close the session shortly.
This concludes today's conference call. Thank you for your participation. You may now disconnect.